Hello, this is Luis. Welcome to the HDTV updates from the European Society of Cardiology Congress 2022. Today we bring you Day 1 updates of ESC 2022. The ESC's annual Congress always issues new and updated guidelines, and this year is no different. Revised guidelines on ventricular arrhythmias and sudden cardiac death recommended that genetic testing and genetic counseling should be undertaken in patients with clinical suspicion or clinical diagnosis of catecholaminergic polymorphic ventricular tachycardia or CPVT. Beta blockers, ideally non-selective naloxone or propranolol, is recommended in all patients with a clinical diagnosis of CPVT. The 2022 ESC Guidelines on Cardio-Oncology is the first cardio-oncology guideline issued by ESC. Fernandez highlighted that the goal of this guideline is to assist all healthcare professionals who care for oncology patients before, during, and after their cancer therapies in terms of their cardiovascular health and wellness. The guideline lays recommendations on the definitions, diagnosis, treatment, and prevention of cancer therapy-related CV toxicity, as well as the management of CV illness induced directly or indirectly by cancer. Delcroix presented the revised recommendations of 2022 ESC Guidelines on pulmonary hypertension. Initial combination treatment with PDE5 inhibitors and ERA is advised in individuals with IPAH, HPAH, DPAH who are at low or intermediate risk of mortality. Initial combination treatment with PDE5 inhibitors and ERA and intravenous and subcutaneous prostacyclin analogs should be considered in individuals with IPAH, HPAH, DPAH who are present with high risk of mortality. The 2022 ESC Guidelines on Cardiovascular Assessment and Management of Patients Undergoing Non-Cardiac Surgery laid revised recommendations on perioperative management of antiplatelet and anticoagulants, and new recommendations on perioperative thromboprophylaxis. Regarding anticoagulant use, the guideline emphasized that in patients with a post-operative indication for oral anticoagulant, NOAC is generally recommended over VKA. Even routine use of beta blockers for the prevention of post-operative AF in patients undergoing NCS is not recommended. McDonald presented the results of the TIME study, which compared the effects of evening over morning dosage on CV outcomes. It was observed that allocating antihypertensive medicine to the evening dose did not improve the primary endpoint. Subsequently, patients can be instructed to take their antihypertensive medicine in the morning or evening because the timing has no effect on cardiovascular outcomes. Ray Kay presented a session on a decade of innovation, guidelines, and paradigm shifts in LDL-C management, where he emphasized that LDL-C lowering should focus on early combination therapy, just like the combination therapies used for BP reduction. The aim is to increase the number of available LDL receptors. Eventually, he concluded that multiple medications with synergy are now available to help accomplish LDL-C targets. This concludes our coverage of the HDTV updates for Day 1 of the ESC 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from ESC 2022. Today we bring you Day 2 updates of ESC 2022. Zanad presented the pooled analysis results of the liver and DAPA-HF trial, stating that advantages of dapagliflozin were evident in all patients independent of ejection fraction. SGLT2 inhibitors might be started in individuals with a clinical diagnosis of HF and no contradictions. Kausner conducted a session on new AF management techniques, discussing how pulsed field ablation is a revolutionary breakthrough approach for AF ablation. Pulsed field ablation will revolutionize catheter ablation by enabling quick, safe, and long-lasting PV isolation and OR, or duplication of the MACE technique. Hausletter reviewed the topic Transcatheter tricuspid valve repair. techniques, and results, and indicated that a number of clinical and anatomic factors should be considered when choosing the ideal patient for tricuspid valve repair. Current registry data shows that in selected patients, favorable clinical results such as less symptoms and fewer HF hospitalizations can be attained. Sudano, in a session on whether gender matters in hypertension, emphasized that females with hypertension are more likely to develop atrial fibrillation and HFpEF, whereas men are more likely to have myocardial infarction or HFrEF. Females have a higher risk of stroke at lower blood pressure levels than males. CV risk increased at lower BP levels in females than in males. These results support the notion that gender does matter in hypertension. In an interesting session on TAVI Turn 20, a look back and a vision for the future, it was discussed that the indications for TAVI are expanding, such as asymptomatic severe AS and at-risk moderate AS. As per 2020 ACC/AHA guidelines, SAVR or TAVI is indicated for patients aged for age 65 to 80 years and TAVI for age more than 80 years. McMurray, in another session on how to treat a patient with heart failure and LVEF more than 40%, suggested that empagliflozin is the first drug to reduce CV death or first HFpEF in HFpEF patients. Moreover, the effect of empagliflozin on CV death and first HFpEF is consistent across multiple patient subgroups with HFpEF. Quotes in the session Beyond Echo and MRI, what other imaging is useful in HFpEF, stress the importance of imaging in detecting, selecting, and monitoring patients with HFpEF, and that cardiac scintigraphy should be utilized in suitable clinical settings and according to recognized protocols. This concludes our coverage of the HDTV updates for Day 2 of the ESC 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the ESC 2022. Today we bring you the Day 3 updates of ESC 2022. Mora presented the results of patient-level pooled analysis of DECLARE TIMI 58 and DAPA-CKD trials and reported that dapagliflozin reduced CVD, hospitalization for heart failure, and kidney events consistently across a wide spectrum of kidney function, but with apparent greater absolute risk reduction among patients with abnormal kidney function. Alexander presented the findings of the Pacific AMI study, the first randomized placebo-controlled trial of asundexian, a small molecule factor XIa inhibitor, in patients with an acute myocardial infarction. Asundexian 50 mg daily inhibited factor XIa activity nearly completely or higher than 90%. Lopez highlighted the Invictus trial findings, which showed that when compared to rivaroxaban, VKAs improved cardiovascular outcomes and mortality without increasing the risk of significant bleeding in patients with rheumatic heart disease AF. Doherty presented the results of the DAPA-HF study in relation to endothelin-1 tertile and reported that higher serum endothelin-1 concentrations were associated with worse heart and kidney clinical outcomes, independently of other prognostic variables including NT-proBNP and troponin T. Petrie presented a session on which drug when, how to sequence heart failure drugs in 2022. Concluded the conventional sequencing is inefficient, time-consuming, and did not allow patients to benefit from early event reductions from all HF medications. He further emphasized that more rapid and non-conventional HFrEF sequences are related with greater reductions in mortality and HF hospitalizations. Sharma presented the final results of the axiomatic SSP dose-finding randomized trial, which found no dose response for the primary composite endpoint of symptomatic ischemic stroke plus covert brain infarction. Furthermore, at all dosages except 200 mg BID, milvexian was related with fewer symptomatic ischemic strokes. Andres reported the results of a systematic review and meta-analysis on oral anticoagulants in patients with AF and stage 4 and 5 renal disease, concluding that the use of DOAC when compared to warfarin did not substantially lower the risk of thromboembolic events. Major bleeding followed a similar pattern, with a non-statistically significant tendency toward reduction in the DOAC group, particularly with apixaban. This concludes our coverage of the HDTV updates for Day 3 of the ESC 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the ESC 2022. Today we bring you the Day 4 updates of ESC 2022. McMurray, in an intriguing session on SGLT2 inhibitors across the spectrum of heart failure, suggested that ACE inhibitors or ARBs, neprilysin inhibitors, beta blockers, MRAs, and SGLT2 inhibitors are the 5 alive or fantastic and/or Fab4 life-saving therapies for HFrEF. According to the DELIVER and SOLOIST WHF trials, dapagliflozin and sotagliflozin are effective in improving HF outcomes respectively. Berwanger presented the findings of the PARADISE-MI trial's win ratio analysis, which indicated that sacubitril and valsartan were superior than ramipril in high-risk MI survivors. For trials with composite outcomes, where the clinical relevance of different types of events is ranked, win ratio analysis can be a valuable adjunct to conventional time-to-first event analysis. Kai, who conducted a session titled How to Achieve Blood Pressure Targets in Clinical Practice, underlined that antihypertensive medication classes acting synergistically might assist to significantly improve BP management. He also proposed that the appropriate antihypertensive therapeutic strategy be determined by an individual's cardiovascular risk profile, as well as blood pressure levels and drug acceptability. Valgimigli presented the outcomes of the 15-month MASTER DAPT trial, which found that perceived ischemia risk or prior ischemic events influence therapy intensity, either DAPT versus SAPT or SAPT versus no APT, but no bleeding risk or prior bleeding events. Bangalore highlighted the findings of the Ischemia CKD Extend study, which revealed high rates of mortality, around 40%, and CV death around 30% in stable CAD and CKD patients after 5 years. At a median of 5 years follow-up, an initial invasive and conservative strategy resulted in similar survival. Bono concluded in a session on multivalvular disease in patients with severe aortic stenosis that moderate or severe mitral regurgitation in TAVR patients is linked with a greater early but not late mortality rate. At 1-year follow-up, 55% of patients with moderate or severe mitral regurgitation at baseline had improved mitral regurgitation. O'Meara presented a session on the management challenge of atrial fibrillation in HFrEF and HFpEF, and underlined that patients with AF and HF represent a high-risk population that may substantially benefit from rhythm-controlled treatment. Catheter ablation for AF is associated with improved quality of life, exercise capacity and LV function, and reduced AF burden, hospitalization for HF, and mortality in patients with AF and HF. This concludes our coverage of the HDTV updates for Day 4 of the ESC 2022. We'll meet again next year at ESC 2023. Till then, take care.